The BD Blunt Fill Needle is a cost-effective, safe alternative for medication preparation that enables easy vial access. The BD Blunt Filter Needle includes a 5-micron filter to remove foreign matter, such as glass particles from ampules. Both needles employ a beveled, blunt needle and help reduce the risk of needle stick injuries due to a 10 times higher skin penetration force. And both needles are packaged with a red shield, alerting users that the product is a blunt needle. Attach the BD Blunt Fill or BD Blunt Filter needle to any standard Luer lock or Luer slip hypodermic syringe. Twist when attaching to a Luer lock syringe. Push firmly when attaching to a Luer slip syringe. Pull the shield straight off the needle. Puncture the stopper at a 90-degree angle with the BD Blunt Fill needle to minimize the risk of catching the internal wall of the vial stopper. For glass ampules, use the BD Blunt Filter needle. Then, draw up the medication to be administered in accordance with your institution's protocol. Passively recap the BD Blunt Fill or BD Blunt Filter needle if required. Detach the needle from the syringe and immediately discard into an approved sharps collector after single use. Follow your institution's protocols for aseptic technique. Follow your institution's policy for safe disposal of all medical waste. The BD Blunt Fill and BD Blunt Filter needles are not to be used for skin injections. Use the BD Blunt Filter needle with glass ampules. The BD Blunt Filter needle is a one-way filter and should be removed once fluid is filtered into the syringe. This guide is not intended as a replacement for the detailed information contained in the IFU. Please consult BD product labels and package inserts for any contraindications, hazards, warnings, cautions, and instructions for use.